Residents of Ga-Chuene outside Limpopo in Limpopo this morning woke up to shocking news that two nurses from this clinic behind me had allegedly been raped by a group of criminals. The information that is at this point not yet that clear is that a group of armed men stormed this clinic and accosted security personnel and went to the nurses and then abducted them, took them to a bush and then later allegedly raped them. But to speak more about what actually happened, I'm joined by the spokesperson of the Limpopo Health Department, Mr. Shikwambana. Shikwambana, thank you so much for your time. This is such sad news. What is the information that you have at your disposal at this time?
Thank you. This is really deplorable. We can't even find words enough to describe or explain it because we have been grappling with issues of abounding crime in our communities, but never had we ever imagined that a case like this can happen where people are meant to take care of the communities are subjected to this kind of barbaric activities. So what we actually have currently is that there is a group of armed men indeed who accosted the security personnel in the clinic, tied them and demanded to be taken to where nurses were. At that time, labor room waiting for patients. They then also tied the nurses, demanded their belongings such as cell phones and car keys. Fortunately, the nurses were able to tell the criminals that the cars that are in the premises are not theirs. The people who own the cars have left with the keys. They then took the two nurses. In fact, they actually locked the security personnel in one of the rooms there and then left with the two nurses to the bush right behind you there, where we're not really sure as of now where exactly, because they had blindfolded them. And it is alleged that they took turns and assaulted and raped them. So at around 4 o'clock in the morning, one of the security personnel managed to escape from where they were locked and requested for help and called the Limpopo police, who then responded immediately. And when they were still busy investigating the scenes at around 5 in the morning, they saw the two nurses reappearing from the bush right behind you, looking very traumatized and hurt. And that's when statements were taken and psychological support was actually arranged immediately. As we speak now, the two nurses are in one of our facilities receiving psychological support. And police are continuing with their investigations. And for now, no arrests have been made.
This is quite deplorable. The department has for the past few years been battling with labor unions around the reinstatement of 24-hour services when we look at clinics. I'm sure this is a setback.
Yes, of course, that is a serious setback because you would know that one of the factors that have actually contributed to many of our facilities reneging from offering the 24-hour service has been issues of criminality as well. Of course, there has been also issues of human resources, the shortage of human resources, but we've been juggling resources, partitioning here and there to ensure that certain of our facilities are actually able to function 24 hours while we are working on bringing in more nurses and more personnel on a staggered basis in the system to ensure that we increase more clinics working 24 hours. You would agree with me that there's a new circular that we've advertised post of many nurses where we're actually envisaging that they will boost that shift of night duty where they'll work 24 hours, increase the number of facilities. But how do you then convince nurses and other personnel to work at night when things like this are busy happening in our communities? How do you then say to them, go there? Because you would know that we can have as many security personnel as possible. But if things are not well in the community level, we are still going to have these kind of things because I'm not a police officer, but you know that in a criminal setup, whoever draws a firearm first wins. Security personnel could be armed, could have all that, but once criminals think of targeting, become so heartless that they even think of targeting institutions such as clinics and hospitals, then we're all doomed because it will mean that we'll have few clinics operating 24 hours, which has got a ripple effect on the service delivery to communities. But also, it increases the burden on our hospital because this clinic of offloaded the burden from the casualty unit of the Luahom Hospital. Now henceforth, it will be that every person who feel unwell at any given time at night will have to go to the casualty ward of Luahom Hospital, which is not conducive. And as a department, we've also taken a decision that this clinic will be closed entirely until we figure out what to do. We'll meet the community leaders and stakeholders next week to come up with a clear way forward. But what we are sure of now is that even if the clinic can be reopened, it's not going to operate 24 hours up until these criminals are apprehended, because you cannot be able to say, let's open at night while those people are still out there. Nurses will be looking over their shoulders thinking they might accost them again and do the same thing.